acid that is produced in the stomach is normal. It is normal for the stomach to be highly acidic. Autoimmune disease is caused by a highly active immune system. So therefore, if our immune system needs to be at level 5, but it's autoimmune, so we should assume it's like level 7. If you live in a natural environment, if you have soil, if you roll around in the grass, if you have a pet, all that actually can help build our microbiome. Hello everybody, and welcome back to the Good Gut Feeling Podcast, where we digest modern medicine with old world wisdom. Today, we're going to talk about something really exciting. We're going to debunk gut health myths, things that you may have been told, things that I have heard many times in my training. We are going to debunk them. Just a quick word, this episode, all our prior episodes are for educational purposes only and don't take the place of medical advice from your doctor. So jumping right in, 5 gut health myths. We are going to debunk them today. These are so common and so prevalent, and most people just assume that they are correct. Number 1, maybe this is not you, but this is the way I was trained, and this is what many doctors tell their patients. What you eat doesn't matter as long as you take the pill. It's only about the prescription medication and nothing about the food that you eat. Honestly, I don't even know where to start with that because it makes no sense. It makes no sense at all. How can we assume that what we eat, the fuel that we put in our body, makes no difference? It's just shocking. There's so much research to show that ultra processed foods, that seed oils, that sugar, that gluten products, depending on the gluten, some gluten's good, dairy products, all can cause inflammatory conditions. This is so clearly seen. However, most doctors are not aware because we are not taught that in medical school. In medical school, we're taught almost no nutrition. As a gastroenterologist, a digestive disease expert, someone who specializes in all the digestive organs that process food, you would think that we are taught about nutrition in a really profound and deep way. But I was taught almost no nutrition in my training, and that is not in just my program. That is almost every single program. And the nutrition that is taught is very basic. We're taught how to give IV nutrition to people who are critically ill, or tube feeds to people who have a feeding tube inserted. But we're not taught what people should eat, just basic things that don't eat gluten if you have celiac disease. But really, what are processed foods? What are healthy foods? What is food as medicine? Which food should you avoid? There's so much out there already known about toxic foods that to say that foods don't matter, to me, is completely ludicrous. Number 2, myth to debunk is that acid reflux or gastroesophageal reflux disease or heartburn, or however you want to call it, or however it's been called for you, is a disease of a high acid state. That it is a disease of a high acid state. And the way that it is treated is through medications that decrease the acid. So many people who have this, and this is a very, very prevalent condition, believe that their condition is due to a high acid state, and therefore they need a drug to bring down the acid. That is not true. The acid that is produced in the stomach is normal. It is normal for the stomach to be highly acidic because that is part of the digestive process. The problem is that the acid from the stomach goes into the esophagus. The esophagus is the food passage. It's the tube that connects the mouth to the stomach. The stomach, I mean, some people think of their whole abdomen as stomach. I mean stomach like the pouch that is on the upper left side of our abdominal cavity, where the food goes right before the intestines and after the esophagus. That's high acid organ because it needs that acid. And that acid is just fine in that organ because it has a special lining to protect itself. The esophagus, on the other hand, does not have that special lining. And when the acid from the stomach goes into the esophagus, it creates an inflammation. It can burn, it can be uncomfortable because the lining of the esophagus is not equipped for that. So the issue is not a high acid state. The issue is that the opening between the esophagus and the stomach which is supposed to be closed when you're not eating, is not appropriately closed. So the acid comes up from the stomach into the esophagus, and that causes symptoms. These symptoms can be burning, pain, discomfort. Some people have a cough, or some people can even have a sore throat. But all those symptoms are from the acid in a place where it doesn't belong. So the issue is truly a state where the muscular sphincter, which is the little opening between the stomach and the esophagus, is inappropriately open at the wrong time. So it's actually a motility disorder. It's a muscular disorder that the muscle of the opening is not appropriately closed at the right time. The treatment that we use is acid blockers, different kinds of acid blockers. And that does sometimes improve symptoms because then the stuff that refluxes is not acidic and doesn't burn as much, and it doesn't cause as much problems for the lining of the esophagus. But it's really a band-aid because it's not the real cause of the problem. Number 3 myth to debunk is autoimmune disease is caused by a highly active immune system. Autoimmune disease is caused by a highly active immune system. So therefore, if our immune system needs to be at level 5, but it's autoimmune, so we should assume it's like level 7 or level 8 or level 10, we just need to bring it back down to 5 by using an immunosuppressant. This is how autoimmune diseases are treated. The answer is no. It's not an immune system that's too active. It's a dysregulated immune system. The immune system is picking up itself, its own bodily organs, its own bodily cells as foreign. So it's not that it's too active, it's just inaccurate. It's inaccurate, and there's so many reasons that autoimmune disease can exist. Yes, many autoimmune diseases have a genetic component like many diseases, but genetics pull the gun. Environment pulls the trigger. And most people are not born with autoimmune disease. So if it's purely genetic, what happened the first 10 years, the first 20 years, the first 30 years? There's always an environmental trigger. Number 4, gut health myth to debunk is if I take an antibiotic for whatever, I take an antibiotic for bronchitis, if someone takes antibiotics for a urinary tract infection or strep throat or for whatever it is, then they can just take a probiotic and then it balances it out. I've heard this more times than you can imagine. Oh, whatever, I'm not sure it's bacterial, it could be viral, but I'll just take the antibiotic just in case, and then I'll just take a probiotic afterwards and it's gonna be fine. Fortunately, that is not the case. I wish it were that easy. I wish it were that easy. But antibiotics are potent disruptors of the microbiome. The microbiome are the bugs that live inside and outside of our body. They're concentrated in the large intestine, and they have so many responsibilities, and they're a vital part of many functions of the body. So we want a robust microbiome. We want a great microbiome with a good proportion of healthy bugs versus the potentially unhealthy bugs. So when antibiotics do their job and they eradicate the strep or the E. coli or whatever bug it is that we're treating, they don't just kill one bug. They kill many bugs, and they kill the good ones with the bad ones. And how many and how much and which ones depends on the antibiotic. But no antibiotic is specific to just specifically that infection, only that. Kill many, many other bugs. Probiotics, on the other hand, are helpful, but they are a drop in the bucket compared to the antibiotics. So don't think you're gonna take an antibiotic and then you're gonna take a probiotic and everything will be balanced. Unfortunately, it's not that easy. So be careful with your antibiotics. Use them cautiously. Use them only when needed. And when are antibiotics necessary? That's a question to ask your doctor, because number one, many infections such as upper respiratory infections are viral. So if it's viral, there's no need for antibiotics. Antibiotics do nothing for a viral infection. Now, if it is bacterial, we have to ask, okay, an antibiotic might help with that, but what happens if I don't take it? Is the infection going to go away anyway? Is it going to go away an hour faster, a day faster, 2 days faster? So how necessary is it? Because remember, there's no antibiotic that doesn't have adverse effects on the microbiome. They all do. The question is, what is the risk and benefit? If the benefit is great, and this is an overwhelming life-threatening infection, well, that makes sense. But if the benefit is really small and we're gonna have a disruption in our microbiome, is it really worth it? And that's the question to ask your doctor. And number 5, myth to debunk. What I need to build my microbiome is a probiotic, and that is the main treatment. And I think you can guess from my previous, from talking about gut health myth number 4, that probiotics are good. And probiotics are helpful, but they do not do the entire job. In fact, they do a small portion of the job. In fact, many of the probiotics you take actually don't even have the colonies they say they have, and by the time they get to the gut, many of them are not alive. So what do we take a probiotic for? They help. They can help. They're not always necessary, because the true way that we built our microbiome is from the inside out. The bugs like to eat, like the good bacteria like to eat fiber. They like to eat prebiotics. So prebiotics, which is plant-based fiber, is, as you guessed, in plant-based foods. Now, plant-based foods can build your microbiome from the inside out. Now, many things are involved in the microbiome. Our microbiome is affected by sleep, by stress, by our mood, by our environment, by toxins. So just having a healthy life in every way, which means sleep, which means stress management, which means good food, good family interactions, that can build our microbiome. That can build our microbiome from the inside out. And you know what's helpful? Getting a little bit dirty in the good dirt. Not in the concrete jungle, but if you have soil, if you live in a natural environment, if you have soil, if you roll around in the grass, if you have a pet, all that actually can help build our microbiome. We've become such a sterile culture. We want to hand sanitize, we want to make sure everything is clean. Actually being in good dirt. I don't mean, New York City dirt. I mean dirt in the country. I mean grass. I mean even the beach, or some natural dirt is actually very helpful to build our microbiome. Kids who grow up with pets have a microbiome that's developed earlier. So we really develop our microbiome from the inside out. So these are my top 5 gut health myths to debunk today. So stay healthy, stay gutsy, and I look forward to seeing you all next week. If you like this, please find us on wholegut.com. We have so much more content on our website, and see you all next week.